It's my pleasure to introduce Ashley Powell. She's always had a passion for marine biology. She graduated from Roger Williams University in Rhode Island with a bachelor's degree in marine biology and another one in chemistry. Wanting to be more involved with animal care, she earned her Doctor of Veterinary Medicine from Atlantic Veterinary College at the University of Prince Edward Island in Canada. She worked for a year as an associate veterinarian at an exotic aquarium practice, and then for a year as a provincial aquaculture veterinarian in Nova Scotia. She is currently an aquatic and anatomic veterinary pathology resident and PhD student at the University of Georgia under the direction of Dr. Al Camus. So Ashley, you can take it away.
Hi, can everyone hear me okay?
Yeah, sure can.
Excellent, thank you so much for the introduction. I really appreciate it. And yes, I'm part of the same crew as Abby and Al here, and I'm very happy to present this case to you of Carnobacterium Meltaromaticum within Atlantic halibut. And this is a collaborative effort between the University of Georgia and the Atlantic Veterinary College at the University of Prince Edward Island. All right, sorry, perfect. Okay, so if you're not familiar with Atlantic halibut, they are the largest flatfish in the world. The largest one recorded was 15 feet long and estimated to be 700 pounds after evisceration and exsanguination. They can live up to 50 years, and it takes about 10 years for them to mature. And at that time, they're about 100 to 150 pounds. So as someone who is 5 foot tall and just shy of 100 pounds, they most certainly dwarf me. They are batch spawners, spawning multiple times during a year. And it takes about 4 years for them to get egg to a market size of 3 kilograms. So as you can imagine, aquaculture efforts, which started in the 1980s in Canada, Norway, United Kingdom, and the United States of America, these are long-term brood. They'll maintain their brood for almost up to 40 years. Okay. And so here is a generic photo of a halibut. There are various species. There's Alaska halibut, Atlantic halibut, Pacific halibut. And the most telltale sign of a halibut is that they have a large gaping mouth. They are always right-eyed fish, and they have this arch in their lateral line and a concave tail. And they're really, really beautiful animals. Here's a facility, the facility I will be discussing today. And you can see it's an indoor recirculating system, salt water. And you can have all of our little halibut friends here in this tank getting grown out to a market size. And here are some of the juvenile ones. So some facilities, they'll hatch them, they'll have their own brood, and they'll hatch them and grow them up to market size, just as this one. Or they'll purchase them at a 200-gram size, about this big, and grow them out to market size. Just like any flatfish, all halibut, as soon as they hatch, they start upright. But as they begin to age, within a few days, they'll begin to lean to one side, and the left eye will migrate to the right side of their head. And here are some nice pictures of halibut. They are pretty charismatic fish. I really did enjoy working with them. So our story here, and as you can imagine, the brood are huge. This is an example of a full-size brood fish. She's probably about 200 pounds. And surprisingly, they're very amenable to handling. They'll often get ultrasounded to check for egg viability during the spawning period. So this brings us to our case. So we have this indoor Atlantic halibut aquaculture facility. They have multiple broodstock tanks, but 2 of them have been having problems. So over the past 2 years, from January 2020 to June 2021, there was 15 mortalities total. And as I mentioned, you can imagine how devastating that is, having these fish pass away when they're so valuable and they should be kept around for such a long time. Although the fisheries, as you had seen in my last slide, although the fisheries are fairly well managed and wild caught fish are fairly sustainable according to the National Oceanic and Atmospheric Association, aquaculture has become a way to meet the demand for these fish. So once again, this is quite important. So we've had these for 15 mortalities, and it's been noted by the site manager before these fish had passed away or became sick, needing euthanasia. They had this chronic wasting disease. They stopped eating. They started to become skinny, which, although for a big fish and a flatfish at that, they can become visibly skinny. They were lethargic. Some of them developed some type of neurological vestibular signs, such as swimming upside down, swimming into walls, or swimming in circles. And some presented as acute death. So I really wanted to get to the bottom of this and see what was going on. With post-mortem examination, we noticed the gills were pale in all fish examined, even the ones that were euthanized just minutes prior. The heart, as you could see here, and I apologize, these were taken in the field. The heart that you could see here, there was a whitish sheen to the surface, and the pericardium and the pericardial area was filled with serosanguinous fluid. So there was effusion around the heart. And we also found incidental parasitic cysts, as well as nematodes, as you can see on the surface of the liver here. And those we consider to be incidental. After all, some of these fish were obtained from the wild, and there is a certain allowed amount of fish you can collect for an aquaculture facility. Here we have the kidney. So we can have the back of the fish here. The head will be over to the left, the tail will be over to the right. And you can see some more of that serosanguinous fluid within the coelomic cavity. If we have a closer look of the kidney, we noticed renomegaly, so the kidney was enlarged. It was often lobulated. Sometimes it also had that bluish white sheen to it, and sometimes it was rather friable. And so we knew that there was something going on here. And this is the ovary. Even if you haven't seen a halibut ovary, you could probably guess, especially being on this PowerPoint here, that it's most certainly not normal. So we have this yellow fibrin material and mucoid material. Instead of a bag filled with beautiful white and yellow marbles, we have all this foamy exudative material in here. And if you can make out the mucosa of the ovary, the inside surface, it's mottled dark red and black. So there is an ophiritis, an inflammation of the ovary occurring here as well. And once again, looking at the abdominal cavity, so head would be over here, tail will be toward the surface. As far as the best way I could fit this image on the screen. We have the stomach here and the intestines here. We can notice that the intestines, at least the surface on the mesentery here, they're really red. They're very angry. They're very inflamed. And that kind of corresponds to the fluid we were seeing in the coelom. So there is some type of coelomitis. There is some type of inflammation, some serositis going on here as well. So we have signs of a systemic disease. So we collected some ovary fluid, we collected some fluid surrounding the heart, and we got a modified transidate. So it's above that 2 grams per deciliter, but below the 3 grams per deciliter, putting in that modified zone. However, I suspect that there was saltwater contamination during the exam. So it's very possible that this protein content was much higher. This is cytology from the ovary. And right away, you could see all these little dit dots in here. And those are our gram-positive rods. And once again, making it even more convincing, getting away from just, oh, that's contamination of the surface. We are seeing the bacteria with inflammatory leukocytes too. And so we could see those all within the cell. And this might be the world's worst gram stain ever, and I apologize for that. I did it myself in the field, but indeed we are looking at gram-positive rods. Prior to euthanasia, in one case, we collected blood and we completed a blood smear. And interestingly enough, within circulating leukocytes, we are seeing, once again, these bacteria. So giving support for a bacteremia. You can see them right here. Proceeding on, we submitted tissues for histopathology. So this is an ovary slide. And now, if you're not super familiar with histopathology, not to worry. Over here, we have kind of more normal ovary. I mean, there's a little bit of more clear space than I would like, indicating edema. But you want to see this nice pink connective tissue. And yeah, you have your little follicles here, your little ova here. Everything looks great. However, now we have all of this cellular, you can see all these cellular infiltrate coming in and separating out the ova. Going up to higher magnification, we have this mononuclear inflammatory infiltrate, so consisting of monocytes, neutrophils, and macrophages, and they're completely expanding the ovary. And we also have follicular atresia as well, the follicles are becoming squished, and the tissue is essentially becoming necrotic. With a gram stain, so this is a similar slide, just a higher magnification with a gram stain. In the background, you see all these inflammatory cells. So some of them are a mix of neutrophils and monocytes. Can't always tell them apart. And there are some macrophages in here. You see this one's eating up a couple of bacteria down here. And we could see just tons of these gram-positive rods, kind of fitting in with what we saw in cytology as well. Similarly, with the epicardium, this is a slide from the epicardium cyphers, and it pretty much looks the same. And so once again, we're seeing all of these intracellular and extracellular gram-positive rods as well. So of course, at the time of submitting for histopathology, we went ahead and we submitted for bacteria culture. And, oh, sorry. So here's our final diagnosis. We saw inflammatory changes within the brain, the heart, the ovary, in most of the cases out of the 15 we examined. I'll get to a little bit more of the specifics later on. However, in some cases, there was evidence of inflammation within the gill, spleen, kidney, and also remember that all that inflammatory surface within the coelom, so yielding polycerasitis. Some of them were acute, and it was mostly neutrophils and monocytes, but most cases were chronic. So this was a really fulminating disease. This has been happening in these animals for a long time, and they're tough, and they're just showing signs of disease, unfortunately, when it was too late and in various organs. So getting back to where I was going with that, my apologies. We isolated Carnobacterium Meltaromaticum. Surprise, surprise. Unfortunately, I had a spoiler alert with my title, and that was cultured out of 11 of 15 cases. In 2 cases, we did not complete culture for various reasons. However, with histopathology, we did find that multi-organ granulomatous inflammation, and the pathologist who had read the slides at the time provided this as a nocardia-like intracellular bacteria. So potentially this could have been Carnobacterium. However, because culture was not completed, we cannot say for certain. In one of the 15 cases where Carnobacterium was not isolated, we found Vibrio. However, there were no other histopathologic findings. So we're not entirely sure what caused the death of that fish, unfortunately. And in one case, one fish was diagnosed with lymphoma as the cause of death. And there was this background inflammation within the endocardium. Even though culture was negative, could it be possible that Carnobacterium was there prior? Possibly. However, the lymphoma was so extensive that was attributed as the cause of death in one of the fish. So we have 11 cases where we suspect that this was the etiology. We proceeded on to do sensitivity testing. And as you can see listed here, we tested with a good range of antimicrobials. All of the cases from 2020, so January to December 2020, were sensitive to all tested antibiotics. So that was good news, all right? Maybe if a fish started showing signs, perhaps we could treat empirically. However, in the first case in 2021, there was resistance to oxytetracycline, which was an antimicrobial that was previously used within the brood. And a second case in 2021 yielded resistance to oxytetracycline, ceftiofur, and sulfamexazole trimethoprim. So unfortunately, this bacteria was capable of developing resistance, and rather quickly. So just a little bit about Carnobacterium Meltaromaticum, and in case you're not familiar. So this is a gram-positive, as we mentioned before, psychrotropic, so it loves the cold water, lactic acid fermenting, facultative anaerobic bacteria. It's considered to be a normal gastrointestinal flora in a variety of salmonid fish, including brown trout, rainbow trout, Atlantic salmon, and sea trout. But it's most known for its use in packaging meats. So in frozen packaging meat and fish products, it's actually used as a food additive in Canada, or rather, at least the #1 strain is. And the reason for that is it's thought to inhibit the growth of Listeria monocytogenes, which is a much bigger concern than the Carnobacterium itself. Although there's no known disease reported in people, there are a few sporadic reports of it being isolated from humans that had another concurrent disease. So we're not entirely sure its role there, but it is deemed to be safe. Interestingly enough, it has been used as a probiotic in finfish aquaculture. because it's considered a normal flora, there is thought that perhaps by providing this as a probiotic, it could now allow innate immunity stimulation. And this has been shown in rainbow trout mostly. So quite interesting what we have here. Do we have a normal flora within these halibut and it's been opportunistic pathogen? There has been no documents of this being isolated from normal halibut gastrointestinal tracts, but it's a very interesting thought. However, Carnobacterium Meltaromaticum in particular has a dark side. So while it has been used as a probiotic, a food preservative, and thought to be normal flora, it has caused disease in a small range of finfish and elasmobranch species. So in your rainbow trout and your lake whitefish, it has been documented to cause pseudokidney disease, which manifests as splenomegaly, hepatomegaly, and renomegaly. And when you have a large kidney, it can also have a gray pseudomembrane over it, kind of like what Carnobacterium meltaromaticum causes. You can also get coelomic effusion, visceral hemorrhage, and petechiate the fin base. So, some of those things do fit with some of our halibut cases. Most recently, and published in Veterinary Pathology just this year, a group of common thresher sharks were found stranded with sepsis and meningoencephalitis. And sure enough, they isolated Carnobacterium meltaromaticum. So these are the images from that paper. Over to the right, you have normal endolymphatic ducts. And I see everything's so nice and organized. You have your connective tissue down here, your sensory tissue right here. But if you look to the left, now that's become all expanded and edematous. And you have way too many cells in here. And all those cells are a mix of macrophages, monocytes, neutrophils, and eosinophilic granulocytes. So this is a mixed granulomatous inflammation. Similarly, down here to the right, we have normal meninges. Now, meninges in sharks tend to be a little bit thicker and cellular than other species, and that's normal. However, to the left, that is most certainly not normal. And so once again, we're seeing similar infiltrate, and the infiltrate within the meninges is extending into the brain as well. And that's how we're ending up with this meningoencephalitis. So now what? Well, we have this interesting bacterium. We have very valuable brood fish. We need to do something about this. So we have taken 3 isolates with varying antimicrobial susceptibility, and we have sent those out for sequencing, hopefully with the ability to identify virulence factors. Perhaps we could develop a PCR for screening. There is a PCR for testing of feed products for Carnobacterium meltaromaticum. However, that has not been applied to live fish in a way of detecting disease. And we're in the process of now revisiting, trying to find a potential source. Is this normal flora that's coming in with the fish? Is there a reservoir within the water? Is there a reservoir within the feed? Halibut are fed a variety of frozen fish. While we try to culture their frozen feed, we did not detect any Carnobacterium within any part of the frozen herring or squid. So not entirely sure where they're coming from, but quite interesting. So please stay tuned. And with that, I'd like to thank, I would definitely like to thank David Groman, who read the histopathology and very much helped me, Dr. Jerry Johnson, Matt Saab, Jan Giles, as well as my support system at the University of Georgia. So here are my references. And with that, please let me know if you have any questions or suggestions. Thank you.
All right, thanks a lot, Ashley. That was an excellent case presentation. Thank you. Interesting one. Any questions out there? Feel free to drop them in the chat box or unmute yourself.
Hey, this is Dr. Thomas Phaeton with the U.S. Fish and Wildlife Service. I'm just wondering, I have some cases as of late that are suspect for Carnobacterium, and I'm wondering if you ran biochems and if they're consistent with what you would expect for C. Meltaromaticum.
Wow, interesting. We did run biochemistry. So the isolates that were ran at the Atlanta Veterinary College, we confirmed with MALDI-TOF. However, we did benchtop biochemical testing at the Nova Scotia Diagnostic Lab in Truro, and yes, they were quite consistent with that as well. I could get you further information if you would like.
Yeah, sure. I might actually be interested in that. I might follow up with an email. Thank you so much.
Sure thing. Do you have my contact information?
I'm sure I can find it.
All right, sounds good. Sorry, I didn't post it.
Oh, no worries.
Hello, this is Ellen Lark. I'm also in the U.S. Fish and Wildlife Service in La Crosse. And I was interested in this because we've had continual Carnobacterium problems with some brook trout in one of our hatcheries. And we've begun treating them with injectable erythromycin.
Okay.
But that's available as an investigational new animal drug. And so you'd have to work through our aquatic animal drug partnership to get it. But it does seem to last quite a while and work pretty well. Those fish are also now in a facility where the water is sterilized coming in using a UV radiation. So.
Very cool. Are you seeing any resistance to the erythromycin at all?
So far, not yet. I think part of the reason for that is it's very long lasting. So that probably is very helpful.
Wow, that's really cool. Thanks for sharing. I mean, it's not cool, but.
Any other questions or comments out there? All right, if not, thank you very much, Ashley, for the presentation.
Thank you.
Right.